According to the New York Times in 2019, the World Health Organization has ranked vaccine hesitancy, the growing resistance to widely available life-saving vaccines, as one of the top 10 health threats in the world for 2019. This article from the New York Times does a good job of bringing attention to the growing issue of anti-vaxxers, but it still struggles in areas. The New York Times provides multiple ways to fight back against the anti-vaxxers, but it provides little support. With an issue that regards health and vaccinations in our world, there needs to be evidence to persuade the many, and that's what this article lacks. I will discuss why the New York Times is wrong in leaving out evidence in history, cases of outbreaks across the US and Canada, and an in-depth look into unvaccinated children. With that, we'll start with the need for more evidence in history. The New York Times uses very little evidence in their article and no history at all. History meaning outbreaks that have happened further in our past. The New York Times article mentions outbreaks in recent years and months that have popped up, but this article needs more of a history lesson. The New York Times failed to think of their readers. Not everyone is fully knowledgeable about the current situation regarding vaccinations, and not everyone knows about some of the worst diseases mankind has faced. By mentioning some of these diseases the world has faced before, such as typhus, influenza, smallpox, mumps, measles, etc., the world can then fully realize the danger that lies ahead of them. When most people decide against vaccinations, they don't think about the world around them and their community and the people. They think about their own individual single home household, and specifically their children, as they don't get them vaccinated. And most of the time they avoid vaccinations to avoid autism. When your kid is born with autism, vaccines doesn't cause autism. You're born with that. With that, we'll move into outbreaks. This article needed more support than it had. The only evidence in this article were numbers about unvaccinated children and some outbreaks in recent years or months, but the readers need to know more. An overall number of how many unvaccinated children exist is a good start, but we need more support and evidence. They need to know that by unvaccinating their children, they have the potential to bring back diseases once eradicated, and that is happening today as measles have returned. 2015 was really when the issue of unvaccinations and the measles really popped up, due to an outbreak at Disneyland in California. This outbreak of measles spread to half a dozen U.S. states and into Canada and Mexico. In 2014, the U.S. saw a record of 644 people infected with measles. This was the highest number of cases in the country in over 20 years. Based on the academic source entitled Measles, Moral Regulation and the Social Construction of Risk, Media Narratives of Anti-Vaxxers, and the 2015 Disneyland outbreak, there's been a good amount of outbreaks in Canada that we've learned about. In 2011, a measles outbreak in Quebec infected more than 700 people. And in 2014, there was another measles outbreak associated with a religious community in British Columbia. Thanks to high rates of under-immunized children, there were 433 cases of measles in British Columbia that year. With that, we move into unvaccinated children and schools. As stated in this New York Times article, we know that there is a great rising number of unvaccinated children, but we're going to take a closer look at those numbers. Children are gross, and we all know this. Children are an easy way to get sick, as they carry the most germs and such, so a school is a prime-time hotspot for all kinds of sickness. With that being said, an unvaccinated child in a public school could cause several issues. Stepping away from schools for a moment, the segment of unvaccinated kids under age 2 rose from 0.9% for those born in 2011 to 1.3% for those born in 2015. Going back to schools, the median percentage of kindergartners with an exemption from at least one vaccine was 2.2%. Getting an exemption in any state is easy. Parental vaccine hesitancy is the most common reasoning, and there could be a variety of reasonings. Outbreaks specifically with children could be a problem in hotspot metropolitan areas such as Seattle, New York, Boston, Miami, LA, because they have international airports, like big airports with a lot of people traveling in and out, and with air travel, and that is one of the easiest ways for disease to spread. In conclusion, as we've seen from this article from the New York Times, it does a decent job of bringing attention to vaccinations, but it still needs help. This article lacks significant evidence, as the evidence provided was slim to none. This evidence also needed to be backed by history so that readers could get an idea of what kind of effect neglecting vaccinations will have. Our world can be scary, and when diseases are involved, it's even more scary. Together, we can help educate others on vaccinations and why we need them to help maintain a safer world.